Time now for a look at your health, and we're doing some reminders tonight. Summer is, of course, the time to be outside, but it could come at a price if you're not careful. So we're going to talk about some of the hidden summer health risks, and to do that, we are joined by Dr. Goldman from UCSD. So we've talked extensively about skin cancer, so that's one we know about, but there's other ones we don't think about when summer hits with the rising temperatures, like eye damage or food poisoning. Talk about some of these things.
Well, you know, the sun will cause skin cancer, but the sun will also cause cataracts. So it's very important, if we're going to wear sunglasses, which we should, they should have a UV protection so that it doesn't allow the sunlight to get into the eyes and cause cataracts.
And I recently read that children can actually get eye damage from the sun, that it's important to cover up their eyes, and I didn't know that.
No, absolutely. So just don't buy sunglasses to make your kids look cute, but having your kids starting to use them at an early age when they're just a few months old, just imprints that on them. When your children see you using them, they'll use them as well.
And food poisoning is always on the rise.
It really is, because when we leave out that coleslaw salad or macaroni salad for more than an hour or two, it's just going to get bacteria. Now, when we are outside and we have those great things that we made, those are not the types of things we want to use as leftovers. So once we've been eating outside, that food needs to be recycled or turned into mulch or something.
Let's talk about drowning, because I grew up in Arizona where everybody has a pool, and drowning, especially children, it is literally an epidemic.
It really is, and it's such an unfortunate thing that's totally preventable. Nowadays, if you have a pool, it should have a fence around it, but that means that the fence should actually be closed. And oftentimes, you know, if you're really busy, you may have the fence open, you're going to take a phone call, you don't realize where your child is. Every year we always hear about a tragedy that can be very easily prevented. Please, we've got to keep our children where we can see them around a pool.
Yeah, even buckets of water or things of that nature, and the play pools, so keep that in mind. It's good advice. Talk about bug bites, because, you know, the bugs come out of the woodwork quite literally, and sometimes as parents we're not sure how to treat them either.
Yeah, bug bites, of course, if you scratch them, can become infected, and so you basically don't want to scratch them. A little trick that I like to do is you can just get some over-the-counter hydrocortisone, put it on the bug bite, then cover it with a Band-Aid. The itch will go away from the hydrocortisone, which will take the bug bite away, and they won't be scratching it if it's covered with a Band-Aid.
How serious is dehydration?
Really serious, especially if we've got kids out there and they're playing volleyball or lots of activities. Two things can happen: dehydration and heat stroke. Heat stroke is where your body temperature actually gets high. People will be a little bit confused, they just won't be acting right. If you feel them and they feel really hot, call 911, because usually they will need to be cooled down and intravenous. While we're waiting for them to get better, cool them off. Water is the best thing to cool off with, so just pour the water off their head. And dehydration is important too. When you're out there doing a lot of physical activity and you're sweating, you're also losing your body water, and so just good old water is going to be fine to rehydrate.
And not just those adult beverages on the beach, which we see happen too often.
No, because alcohol is going to make you even more dehydrated. So, you know, it's that usual thing: when you have a glass of beer, you have a glass of water.
All right, good advice, and thank you. Summer is unofficially here.
I know, but look at it, it's gorgeous.
It is. Lauren, over to you.
All right, thank you.